Okay, good afternoon, everyone. You'll note that today we'll be starting our discussion of Chapter 11. This is Chapter 11, Part 1. Again, I think when people are taking anatomy physiology, they generally think, I'm going to be learning about the skeleton or I'm going to be learning about the muscles. And in this case, you are true. That is true. We'll be learning about the muscular system. It's going to be a very dense lecture. We're going to have a lot of muscles that we'll be going over. Again, just take note of where I circle things, where I underline things. Those will be the muscles you will be required to know. And I think there'll be some extraneous information here you can kind of disregard, so just take note of those as well. And we'll begin this lecture by ultimately going over kind of general rules of thumb of how muscles are named, kind of how muscles act as, and how muscles generate force against skeletal appendages. And so, yeah, let's go ahead and start our discussion here. Okay, so there is quite the laundry list of study guide questions here, talking about how skeletal muscles produce movement, all the way down to origin, insertion, action of eye muscles that move eyeballs, as well as abdominal muscles that protect the abdominal viscera and move the vertebral column. So we've got quite a bit to cover in today's lecture. Okay, so for today, make sure you've answered the questions for Chapter 11, Part 1. Your quiz is due by Friday midnight. I've lost count of what quiz number it is. It'll be posted on Wiley Plus. So just whatever quiz is for Chapter 11, make sure you're on top of that. The homework, just take note that there is no adaptive practice due next week, just because we are going to be reviewing the material on Tuesday, so there's no adaptive practice. And then Thursday, we will have our second exam. So coming up on October 22nd is our second exam coming up. And again, it's going to focus primarily on bones and muscles. And then your Pro Section 2 is going to be due Friday, not this Friday that I'm recording this, obviously, next Friday, which let me check on that date here really quick. The date for that is going to be the 16th. So Friday the 16th, you'll have your second Pro Section due. That Pro Section is going to be focused on Chapter 11 material. Okay, so this is kind of a shift. If you weren't in class this week, you didn't miss some of the announcements. I'm going to be posting the update of those announcements onto Moodle, and then I'll also be making a little announcement video as well. Okay, so how do skeletal muscles produce movement? So they do this by exerting force on tendons, and those tendons are going to be anchored to bones / aka the skeleton. So the tendons are attached to and pull on bones, and then movement occurs. And there's a lot of physics behind this, exercise physiology, a lot of just, again, physics and torque and fulcrums. We're going to talk about all that fun stuff here. So if you're interested in watching kind of more dynamic, I guess, projection of this, you like the movies, go ahead and click here. Okay, so when we're talking about an origin and insertion of a muscle, again, it's going to be part of how we characterize all the muscles. Most muscles cross at least one joint and are attached at the articulating bone. So here you can see the example of the shoulder joint. You have your scapula. Here's your origins from the scapula and humerus that are located here and here. Here are your tendons, your origins from the scapula. And then if we look at the bellies of the triceps brachii muscle, here you can see kind of the belly of that, the bellies of the biceps brachii, triceps and biceps, probably more commonly known. And then you can see that there's more tendon located down here for the insertion on the ulna. So luckily, things like the scapula, the humerus, the ulna, right, you should be very familiar with. We just discussed an entire chapter on that. But this, again, shows your origins as well as your insertions. So the case of the triceps brachii and the triceps brachii and triceps trachei, biceps brachii, triceps and biceps, triceps and biceps. You can see kind of the insertion origin points located here. So for the, I guess, one important thing to kind of recognize in terms of the difference. So let's look at them individually. So for your triceps brachii, your origin is going to be from the scapula and humerus, and your insertion is going to be on the ulna. And then if we look at the origin of the biceps brachii, your origin is going to be from the scapula. Here's the belly, and then your insertion is going to be on the radius. Here you can see that insertion point. So origin, belly, insertion. Again, we're going to be breaking down most of the muscles in this regard as to where their origin is and where their insertion lies as well. So origin, the attachment of the stationary bone, and insertion is the attachment to the movable bone. So you can think of the humerus as maybe being the stationary bone, and then let's say the movable bone down here would be your radius and your ulna, and those muscles are going to be accommodating that movement and utilizing the force of contraction of the muscles to generate that movement. Okay, so really muscles work as a system of lever systems and utilize leverage. And so we just talked about the biceps brachii. As an example, we talked about its origin and insertion. Here you can see, again, the stable bone and then the movable bone that you see here. The lever is acted on by resistance and effort. Here, again, when we're talking about the movement, you can recognize that the fulcrum here is located at the elbow joint, and then the load would be here, let's say in that hand. And so the effort is ultimately going to be in the upward motion, and then the fulcrum is going to kind of assist in the movement of that forearm more superior, more medially in those directions. So again, you can see here your origin, your insertion, the amount of force that's generated is going to be a result of the movement and action that's expended by the biceps brachii. Okay, so there are several different types of lever systems that are, exist within the human body. So a first-class lever you can kind of think of as having the same type of fulcrum load effort arrangement as there would be in a pair of scissors. And so your fulcrum kind of lies at the center here. Your effort is onto one side, your load movement happens on the other. So here you can see the example of the muscle here, the back of the neck, which I won't say the name quite yet because I don't want to overwhelm you, and we're going to talk about this extensively here at the towards the end of class. So here you can see that effort, where the effort is being generated, your fulcrum here is in the center, and then your load would be here in the front of the head. So if you're going to, let's say, tilt it down. Your second class lever system works kind of like a wheelbarrow with your fulcrum to one side, your effort on the far side, and your load kind of being moved in the center in the opposite direction. So here you can see the fulcrum at the ball of the foot, and your calf muscle here. Again, we'll be learning all about the names of these muscles, and I don't want to overwhelm you at this point, but your effort is going in the upward motion, and then your load in this instance will be going down. Okay, and the last third class lever that you see here, your fulcrum's all the way off to one side, your effort's kind of in the center. Again, that's where you would be applying that pressure, and your load is essentially moving on the very end of that. And so the example that we just talked about here with biceps brachii, you have your fulcrum, your effort to the right of that, and then your load kind of a little further as far as possible away from that fulcrum. So again, we're able to go pretty quickly through first and second and third class lever systems, and kind of, again, the way that each of these muscle actions are characterized is based upon essentially where the fulcrum is in relationship to the effort and the load. So again, first class lever, you've got that fulcrum in the center. Second class lever, you've got the fulcrum kind of essentially to the right, your effort to the far, and your lever kind of in the center. And then the arrangement for your third class lever would be your fulcrum to the far side, your effort in the center, and your lever and your load, I guess, to the far side opposite of the fulcrum. Okay, so we have not discussed fascicles, I guess, extensively because we haven't really introduced the structure of muscles. I will be recording a lecture on muscle structure, different types of muscles. That's going to be for your viewing for the purpose of answering some extra credit quizzes and homework questions. Again, I'll be recording a video kind of explaining that. But essentially, when we talk about fascicles, we're talking about muscle bundles. So muscle fibers are arranged in a set of parallel bundles within fascicles. And the fasciculi in relation to the tendon can vary. So the fascicular arrangement is correlated with the amount of power the muscle can produce and the range of motion as a muscle can produce. So this all sounds very theoretical. So really probably the best way to kind of show the I guess, effect of this, of fascicular arrangement, is to look at some examples. So here you can see some different examples of parallel and fusiform. So fascicles arranged in a longitudinal axis of the muscle terminate at either end in a flat tendon. So your sternohyoid muscles, which we'll talk about a little later on. And then the fascicles are nearly parallel to the longitudinal axis of the muscle and terminate in flat tendons. Muscles taper towards the tendons where the diameter is less than the belly. So this is kind of like a larger fascicular bundle near the center, and it tapers off towards the end near the tendons. And the digastric muscle is going to be an example of that. A circular muscle in concentric circles. The examples of here would be for the sphincter muscles that enclose an orifice or some type of opening. So wherever you see kind of an opening in the muscles that are going to be utilized for the opening and closing of a region, that's going to be the particular fascicular arrangement. And then triangular, they spread over a broad area and converge at a single tendon. So the pectoralis major is going to be an example of that, where you've got this triangular appearance of the fascicle. Unipennate is fascicles only arranged on one side of the tendon. Bipennate, you've got fascicles on two sides. And then multipennate, you've got multiple fascicles attached obliquely in many directions to several tendons. So the deltoid muscle is going to be an example of this. Erectus femoris is going to be an example of bipennate. And then the extensor digitorum longus muscle would be a unipennate example. Okay, so we're talking about coordination within muscle groups. In order for movement to be coordinated, there has to be different kind of, I guess, interactions of muscle groups. So you have your agonist prime mover, which is going to be moving your, I guess, your load of interest into the direction of interest. Your antagonist is going to be kind of the opposite of that. It's going to provide kind of a counterbalance to that movement. And a synergist would be muscles that kind of aid in that agonist or primer movement. This is, I think, the only slide that we have on this. This is a particular topic that you could probably spend, 10 or 15 slides talking about the action of an agonist, antagonist, and a synergistic muscle and muscle groups. But that's not necessarily, I guess, the focus of today's lecture. So I'm just going to kind of, again, just briefly describe to you how muscle groups are essentially arranged in these pairs, depending on how they're acting on their load. Okay, so let's move forward and talk about how muscles are named. Okay, so naming of muscles is not as straightforward as you would hope that it would be. Muscles are named based on a lot of different characteristics. So they can be named based on location, based on their size, based on the number of origins, based on their appearance, based on the direction of fibers, origin insertion, as well as muscle action. So there's really just no one way muscles are named. They're named for a whole variety of reasons. But we're going to go ahead and go through some examples of the names that are associated with each one of these naming systems. And so hopefully that'll kind of make this a little bit more clear to you. And it's also kind of a nice way to introduce some of the different muscles that we'll be talking about. Okay, so for direction, orientation of muscle fascicles relative to the body's midline, again, the midline down the center. So rectus is parallel to the midline. So rectus abdominis. Transverse is perpendicular to the midline, transverse abdominis. And then oblique is going to be diagonal to the midline, external oblique. Again, when we talk about abdominis, hopefully you start to kind of think, okay, what region of the body that might that be located in? Probably the abdomen. So again, we're talking about different abdomen muscles when we talk about the rectus, transverse, and external oblique. Okay, other ways muscles are named is through size. And so you can't just say small, because you can't say large. You've got this whole variety of ways in which muscles are named. So you have maximus, meaning the largest, gluteus maximus. You have minimus, gluteus minimus. Hopefully your gluteal muscles, somewhere in the recesses of your mind, you're like, I think I've heard of gluteal muscles before. Your hind end, your butt. Longus, your adductor longus, your adductor brevis would mean for short and long muscles. Latimus and longus, meaning widest and longest. Your latissimus dorsi, your longinus capitis. The magnus, meaning large, major and minor, major larger, minor smaller. So some of these like naming relative to size is relative to another muscle that it's related to. So the pectoralis major and pectoralis minor, again, are going to be describing the muscle sizes relative to one another. And the vastus, which is huge, and we'll talk about the vastus lataris a little later on. Okay, so one way muscles are named via size. Another way that they're named is via shape. Okay, so hopefully some of the names kind of innately bring to mind a shape, right? A deltoid is going to be triangular. The deltoid is the example of that. Trapezius, trapezoid shaped. Trapezius is the name of the muscle. Serratus, it's sawtooth. So if you think like of a serrated knife, the serratus anterior is an example of that. Rhomboid is diamond shaped. So the rhomboid major, we'll talk about that one. I'm not sure if that's today or on Thursday. Ocularis circular, ocularis oculi, maybe something in this region, could be that muscle group. Pectinate, comb-like pectinus. Piriformis is pear-shaped. Platus is flat. Quadratus is square or four-shaped. Think of like quad, what a quad is. Gracilis is slender, and the example is gracilis. Okay, so that's the muscles according to shape. Here are the muscles according to principal action, or kind of what they do. So the name flexor decreases angle joint, flexor. Extensor increases angle joint, increases angle joint. Adductor moves away bone away from midline. Adductor moves bones closer to midline here. Levator raises or elevates body parts. Depressor lowers or depresses body parts. And supinator turns palm anteriorly. So again, we'll go over all of these examples more in depth, but this is just kind of, I guess, a great way to introduce some of the nomenclature we'll be going over. Some of it might seem confusing and like you're using a lot of words to describe a single muscle group, but hopefully knowing the way that muscles are named will give you some insight as to kind of predicting what a muscle might be named. Okay, we just talked about supinator. Protonator turns palm posteriorly. Sphincter decreases the size of an opening. Tensor makes body part rigid, and rotator rotates bone around longitudinal axis. Let's see, other types of naming nomenclatures we'll talk about. Number of origins of tendon. So bicep has 2 origins. We already went over biceps brachii, and then triceps has 3 origins, triceps brachii. And then quadriceps have 4 origins, quadriceps femoris. So again, some of these, I think some of the nomenclature we were talking about here might seem a little bit more familiar to individuals rather than others. But hopefully, once we finish this chapter, everybody kind of gets to the same place. Okay, let's see, structure, another way things are named is structure that's near the point of which the muscle is found. So temporalis, muscle near the temporal bone. Your example is the sternocleidomastoid originating from the sternum and clavicle inserting into the mastoid process of the temporal bone. And then, oh, I guess it's just kind of it, and going over the example of origins and insertion. So location where a muscle is found, near where the location is, and then also where origin and insertion points are as well, can sometimes be clues as to where that muscle is located. Okay, so now we get down to the nitty-gritty of the overview of principal skeletal muscles. Okay, so again, don't get overwhelmed. We're looking at the entire interior view of the body. But again, these are going to be kind of the big muscle groups that we'll slowly but surely kind of work our way through here in the next couple lectures. We're going to start with the head, shoulders, upper abdomen with this lecture, and then we'll kind of finish off with lower body in next lecture. Here's the posterior view. Again, you can see some of the larger muscle groups apparent here. Some of them, again, might be more familiar to you than others. People who maybe lift weights or do a lot of exercise phys stuff outside of class, maybe, are aware of things like trapezius and deltoids, brachialis, we talked about the gluteus maximus and gluteus minimus. Again, all muscle groups that are maybe probably more commonly used in vernacular than some of the other ones. Things like the sternocleidomastoid mastoid, maybe not something that you hear a ton. Okay, so again, if you find these videos useful, this is a great opportunity to click on that and get another explanation of the material. So muscles that move the head that are used to produce facial expressions. So when we talk about the muscles that are in the head, the face, the main function of them is to produce expression. We'll note here, just note some of the cranial nerves that are innervating those muscles to cause them to move. We're just noting the cranial nerves. You don't have to know the cranial nerves at this point in time. We're going to talk about cranial nerves when we get to the central nervous system, but that is just, I guess, an important point because those cranial nerves are going to innervate specific regions of the face and again are going to allow for different types of emotions to be elicited. Okay, so again, the main function of this muscle group is to produce facial expression, also for mastication. That's also going to be an important point. Lie within the subcutaneous layer, originating on the fascia or bones of the skull and inserting into the skin. And when these muscles contract, they move the skin rather than the joint. And so you have kind of, again, not necessarily the same type of movement associated with facial tissue than you do with other regions of the body. Okay, so this is a nice, I guess, overview of a lot of the muscles that we'll be talking about. Again, anything that you see me kind of highlighting here, anything that's in that dark kind of highlighted, I guess, type is worth recognizing. So your occipitofrontalis, your temporalis, again, this is kind of indicated by the underlying bone structure we've already hit. The levator labii superioris, you'll see here, again, when we talk about the underlying bones that it's going to be that it's interacting with. The zygomaticus major and the zygomaticus minor. Fun fact, in college, my volleyball team was named Zygomaticus major because we had a PT person on our team. But again, these are the facial muscles that are required for things like kissing. They allow that kind of scrunched up facial expression to have. But again, when we think about the zygomaticus bone, that's going to be the underlying bone here. So if you've learned the bones, sometimes knowing the bones pays off to learn the muscles. The rostoris is again, right kind of lateral to that. The platysma, you can see located here and here. Your depressor angulari oris is kind of covering mandible, as you see down there. Depressor labii inferioris is kind of lying underneath there. Your mentalis, located kind of down here at your chin. The orbicularis oris, located around the mouth. Again, we went over that example before. I think I might have gestured to my eye. Really, I threw you off there. Again, it's right here around the mouth. The masseter, again, is a important muscle and jaw movement. Buccanter, the levator angulari oris, and then the corrugator supercilii. So again, this might seem like a lot, but we're going to go ahead and look at this from a few different angles, but this is just a nice introduction to these muscle groups. Okay, so if we move from the anterior view to the lateral view, we can see that temporalis that we saw in the previous image here, the occipital frontis, the orbicularis oculi, the zygomaticus major, the zygomaticus minor, we've hit that before, the levator labii superioris, the levator angulari oris, the muconator, as well as the rostoris. We also have the depressor labii inferioris, the mentalis, the depressor anguli oris, and then that other kind of large muscle group that we hit upon the last figure, but it's a little bit easier to see, I think, from this angle, the platysma, and then also the important role of that masseter in creating that jaw movement. The other one that we probably worth noting is that occipitofrontalis. So again, this might seem like a lot of labeling, but we basically labeled the same exact muscles on the last image. There are a few additional ones that we've gone over in this. So I'm just kind of repeating these muscle groups again and again from these different orientations in terms of kind of studying. Maybe the best thing to do is to just kind of wipe them out and kind of go through writing them in again, and again, and see if you can just start to train your mind to say, okay, that's the zygomaticus major. That's the masseter. Okay, so like the previous chapters, the nice thing that this particular textbook does is it kind of shows you the picture, and then it shows you another different way to present the material, and often that's in a table. What's nice about the table is it allows you to compare and contrast all of these different muscle groups and talk about things like where their origin is, where their insertion is, the action, as well as the innervation. So I introduced the idea of the cranial nerves playing an important part in excitation and activation of these different regions. And so this is part of this table, but I'm not necessarily going to make you know and recognize the different cranial nerves at this point in time. So the scalp muscles, for the frontal belly, the origin is going to be the epicranial aponeurosis. The insertion is the skin superior to the supraorbital margin, and the action is to draw scalp anteriorly, raises eyebrows, wrinkles skin of the forehead horizontally, as in a look of surprise. And then you get a bunch of wrinkles up there. Okay, next we have the occipital belly. So not surprising, the origin is the occipital bone. Remember what the occipital bone is? Okay, and the mastoid process of the temporal bone. The insertion is the epicranial aponeurosis, and this is going to draw the scalp posteriorly, and this is innervated by the facial nerve, the 7th nerve. So there are multiple, again, cranial nerves. They're numbered. Often the number is accompanied by sometimes the description of where that innervation is actually intended to innervate. So here it's telling you that it's a facial innervation. Orbicularis oris, muscle fiber surrounding the opening of the mouth. So the skin at the corners of the mouth closes and protrudes lips, as in kissing, compresses lips against teeth, shapes teeth during speech. So this orbicularis oris is going to be found right in this region here. Zygomaticus major, origin, zygomatic bone, angle at the mouth and orbicularis oris, draw angles of mouth superior and laterally as in smiling. Okay, so zygomaticus major, there you go, all activated right there. Oh, you'll see there that there are the same facial nerves that are innervating those regions as well. This facial nerve 7. Zygomaticus minor, a smaller or lesser muscle here. Its origin is a zygomatic bone. The insertion is the upper lip. Raises and elevates the upper lip, exposing maxillary upper teeth. So again, same innervation of cranial nerve 7 there. Levator labii superioris, superior to the infraorbital foramen of the maxilla. So again, knowing bone structure is important. Skin at the angle of the mouth and raises the upper lip. And it's also innervated with that facial nerve 7. Depressor labii inferioris, the origin is going to be the mandible, skin of the lower lip. Depresses the lower lip, facial nerve 7 again. Okay. Depressor angularis, also origin in the mandible, angle of the mouth, draws the angle of the mouth laterally and temporally, as in opening the mouth, as I am doing quite a bit of right now, opening of the mouth. Okay, levator angulate oris, inferior to the infraorbital foramen, skin of the lower lip and orbicularis oris, draws the angle of the mouth laterally and superiorly. Facial nerve 7, again, is the innervation cranial nerve. Buccinator, the alveolar process of maxilla and mandible at the pterygomandibular raphe. The fiber does expand, extending from pterygoid process to the sphenoid bone to mandible. That's very in-depth. You don't need to know to that level of depth. The insertion point is the orbicularis oris, and the presses the cheek against teeth and lips, as in whistling, blowing, sucking, drawing the corner of the mouth laterally, assisted mastication, and keeps food between the teeth and not between the teeth and cheeks. Okay, so the buccinator's got a lot of action going on. Again, same cranial nerve, facial nerve is innervating. Restoris, the fascia of the parted salivary gland, skin at the angle of the mouth, draws the angle of the mouth laterally, as in grimacing. I'm sure this is highly entertaining to whoever's watching all of the facial expressions that I'm showing. Mentalis is, the origin is going to be the mandible, and then the insertion is the skin of the chin, and elevates and protrudes the lower lip and pulls the skin of the chin up, as in pouting. My 8-month-old does this, and it's really cute, and I should stop talking about him. But muscles of the head. Okay, so those again are many of the muscles in the face that we've talked about that kind of exhibit the different movements of the mouth. In particular, we really focus on this region here. So now let's kind of move our way up to muscles of the head that move the eyeballs and upper eyelids. Okay. Whoop. Okay, so these are called extrinsic eye muscles because they originate in the orbit and insert in the sclera. There are three extrinsic eye muscles: superior and inferior recti, lateral and medial recti, superior and inferior obliques. So we've got a bunch of muscles right around our eye. They're going to assist in the movement of the eye all the way around. And there are different, we'll talk about the innervations there. Okay, so we should need to get back to the highlighting here. So you have your superior oblique. So if we follow that down here, that's kind of, again, the most superior muscle group that we can see here in terms of the muscles that are inserting into the eye. And then you have your levator palpae superioris. It's actually cut, so you can see the cross section cut here. The superior rectus is located, again, just located tucked right here on top of the eye. You can see its insertion point. And then you have your medial rectus kind of located to that one side. You have your lateral rectus. So your medial and lateral will be, medial, lateral, in relation to your midline. And those muscles are going to be important for moving the eyes side to side. Your inferior rectus, again, inferior, superior, inferior, superior. So that should hopefully help. Inferior rectus, superior rectus, superior oblique, inferior oblique, lateral rectus, or yes, lateral rectus, medial rectus. So again, all of these are going to be important in moving that eyeball in all the directions that you want to move it. So this image over here is great for that. Again, you have your medial rectus, your lateral rectus, your inferior oblique, your superior rectus, your superior oblique, your inferior rectus. And so it's showing you all the different ways in which the eye is moved by the motion or the activation of these different muscle groups. So oblique, rectus, I think this does a nice job of kind of bringing together all those different eye movements. Okay, so muscles that move the eyelids themselves, these guys up here. So the tendon of the levator palpebrae superius passes the eyeball and inserts into the upper eyelid, and the point of insertion allows to raise the eyelid or open up those eyes. So we can kind of see here, this is an interesting cross section. Looks like a cadaver that we're working with here. So you have your frontal bone that's cut, your superior rectus, you can see the medial rectus kind of tucked back in there, your lateral rectus very apparent up here, your inferior rectus, your inferior oblique, and then here's your levator palpebrae superioris, which we're talking about here. It's going to innervate that eyelid and allow for the opening and closing of that eyelid. So again, don't get overwhelmed. This is a slide of completely new nomenclature. You've seen much of this in the past couple of slides. Okay, so muscles of the upper eyelids. So your superior rectus, the origin is a common tendinous ring. Your insertion is a superior central part of the eyeballs, moves eyeballs superiorly and medially at elevation and adduction, and then rotates them medially. So I don't know if saying the name of the muscle and then making the motion with your eye is useful, but it's worth, just kind of noting. You'll recognize here that the innervation here is a different cranial nerve. Instead of the cranial nerve 7, you have the ocular motor nerve, which is the cranial nerve 3. Again, you don't need to memorize these, but this is a great place to start talking about them because this is direct interaction of the muscles, the nerves with the muscles and the motion that they generate. Okay, so that's the superior rectus. Your inferior rectus essentially is the same insertion point as origin as above, and your insertion point is the inferior central part of the eyeballs. So it moves eyeballs inferiorly and medially and rotates them laterally. Okay. The ocular motor nerve, again, is a nerve responsible for that innervation. Okay, so the lateral rectus has the same, lateral rectus has a similar origin. The lateral side of the eyeballs, lateral rectus moves eyeballs laterally. The abducens nerve, this is a different nerve than we saw before. The cranial, instead of cranial nerve 3, it's abducens nerve 6. The medial rectus is the same as above and is inserting into the medial side of the eyeball, moves eyeballs medially. and that's mediated by the oculomotor nerve 3. Okay. Superior oblique is origin is interestingly the sphenoid bone, superior medial to the common tendinous ring in the orbit, and then the insertion is the eyeball between the superior and lateral recti, and the action is going to move eyeballs inferiorly and laterally and rotates them medially. And this is a different cranial nerve. Here you have the trochlear nerve, which is the cranial nerve 4. So well, slowly but surely, we're hitting a lot of the cranial nerves here, the trochlear nerve, the oculomotor nerve, the abducens nerve, the facial nerve, which we've already hit, which is cranial nerve 7, but not necessarily the focus of this lecture here. The inferior oblique origin is the maxilla in the floor of the orbit. The insertion is the eyeballs between the inferior and lateral recti, and the action is to move eyeballs superiorly. This is also oculomotor nerve 3. Lastly, the levator palpebrae superioris. We talked about this just a few slides ago. And again, the main action of this is going to be elevating the eyelids. So at this point, you're thinking, man, we are going through a lot of origins and insertions and actions. Will we need to know all of these? The answer to that, no. You will only need to be essentially able to label these muscles on an image provided, unless we talk very specifically about a muscle's action. That would be kind of the only thing on these tables that you'd need to memorize outside of the muscle itself would be the action. Origins and insertions, not going to learn at this level of coursework. However, if you do plan on taking a 200 level anatomy physiology class, you may spend a lot more time there. Okay, so we're slowly but surely working our way through the face, right? Talked about, around the mouth, raising the lips. We've talked about eyes, how things move the eyes themselves, as well as open up the eyelids. Now we're going to talk about the muscles that move the mandible and assist in mastication and speech, aka chewing and talking. Can you chew and talk at the same time? No. But should you? No, probably not. Okay, so muscles that move the mandible are known as the muscles of mastication. What's interesting note is mastication is really considered the first step of digestion. So when we talk about the digestive system, which will be, when I say we, if you take this class next semester and you talk about digestive system, mastication is the first step of digestion. Okay, so the muscles that are involved in mastication here. Again, we've seen some of these muscles before in previous slides. We've seen the temporalis, we've seen the middle purgatoid, and then the lateral purgatoid. Again, the rest of these are basically just bones that we've already covered, right? We've already talked about the parietal bone, the occipital bone, the zygomatic bone. We've talked about the ramus. We've talked about the frontal bone, nasal bone. And so hopefully at this point, you feel pretty confident. Other bones that are new that we may, muscles that we have not talked about here are buccinator, and then the orbicular oris, which we talked about a few slides ago. So again, hopefully you're starting to gain some confidence. Some of these words and bones and muscles you've learned, you've seen before, you have memorized very well, and now you're kind of just combining that information with new information that you're learning now. Okay, so the masseter, the origin is the maxilla and zygomatic arch. The insertion is the angle of the ramus of the mandible. Elevates the mandible as in closing of the mouth. And the innervation is the mandibular division of the trigeminal nerve, the fifth nerve. Again, we're talking about all of the cranial nerves, essentially, when we're talking about these. The muscle, the temporalis. The origin is the temporal bone. Insertion is the coronoid process ramus of the mandible, elevates and retracts the mandible. And the mandibular division of the trigeminal nerve 5. Okay, the medial purgatoid is the origin is the medial surface, and the insertion is the angle of the ramus of the mandible. The action is that it elevates and protracts the mandible and moves the mandible from side to side. And the innervation is the mandibular division of the trigeminal nerve of that fifth cranial nerve. Lateral pterygoid is the greater wing and lateral surface of the lateral portion of the pterygoid xylus of the sphenoid bone. And the insertion is the condyle of the mandible. So the action here is going to protract the mandible, depresses the mandible as an opening of the mouth, and moves the mandible from side to side. Mandibular division of the trigeminal nerve, very similar to the medial. Okay, so Muscles involved in mastication. Okay, muscles that move the head and tongue that assist in mastication and speech. Who knew? So many muscles required for these actions. So the tongue is a highly mobile structure, as I've shown you today, talking a lot, and it plays a critical role in mastication, taste, and swallowing, and it's also important for speaking. The tongue is attached to the mandibles and styloid process of the temporal bone and the hyoid bone, which we didn't talk about a ton when we went over the skeletal system. We did briefly mention it. There were a few slides that showed the hyoid bone. Okay, so let's start highlighting some of these. So you have your hyoglossus. Again, let's just go ahead and carry out this, showing you this large muscle group here, the glenohyoid, smaller muscle group here, the glenoglossus, which is kind of in this general region, the hepatoglossus, which is right here, and the styloglossus, which is a little larger bone that you see located here. So it's an interesting kind of cross section. It's provided here. I'm just trying to look at some of the other different nomenclatures that you see here. Don't get too bogged down in them. Again, just the stuff that's kind of highlighted is what we're going to go over here in the next couple slides. Okay, so the genoglossus is the origin is the mandible. The action is going to depress the tongue and thrust it anteriorly. Protraction, again, a different cranial nerve. We haven't discussed the hypoglossal cranial nerve 12. The styloglossus, which is origin in the styloid process, the temporal bone. This elevates the tongue and draws it posteriorly. Retraction, and the hypoglossal nerve, again, is the nerve that innervates this region. Hypoglossus, origin is greater horn and body of the hyoid bone. It's the side of the tongue. It depresses the tongue and draws it down to its sides. That's the hypoglossal nerve 12. And the patagoglossus elevates posteriorly portions of the tongue and draws soft palate down on the tongue. And again, this is innervated by the cranial nerve 10. So again, going through kind of a quick laundry list of these muscles, and yes, it's just gonna be a lot of memorization. So moving on, the muscles that the anterior neck that assist in deglutition and speech. Okay, so these muscles are going to elevate the hyoid bone for the oral cavity and tongue during swallowing, and most of the infrahyoid muscles depress the hyoid bone to and move part of the larynx. I don't think we'll talk about the larynx a ton here. Okay, so let's go ahead, tip your heads back, and let's start looking at these muscles that you can see here. So your digastric, you can see here, very large muscle, whoop, right there, that huge digastric. We talked about that previously when we were talking about muscle vesicle shapes. Here's your stylohyoid located here. Again, you've got your hyoid bone here, so you can see how these muscles are interacting with that. Your sternohyoid, your omohyoid, located here and here. Your thyrohyoid, maybe nomenclature related to its interaction with the thyroid. The sternothyroid, located here, and the myohyoid, which is located, here, kind of right underneath your chin. Okay, so again, anything that is bolded is considered open material that we can discuss. And we'll be covering those in the next couple slides. Okay, the digastric elevates the hyoid, depresses the mandible, as in the opening of the mouth. And we have, again, a series of innervation, cranial nerves, cranial nerve 5, as well as 7. We're talking about the anterior or posterior belly. Stylohyoid elevates the hyoid bone and draws it posteriorly. Cranial nerve 7. Myohyoid is the trigeminal nerve 5, and elevates the hyoid bone and floor of the mouth and depresses the mandible. Genohyoid elevates the hyoid bone, draws the hyoid bone and tongue anteriorly and depresses the mandible, and this is innervated by the first cervical spinal nerve. Okay, so these are all of these so far just the suprahyoid muscles, and then if we go into the infrahyoid muscles, the omohyoid is going to depress the hyoid bone and branches is innervated by those cervical nerves, those first few nerves of the cervical region of the spine. Sternohyoid, sternothyroid, thyrohyoid, we hit upon, depresses the thyroid, and we talked about how it depresses and also can affect the cartilage of the larynx, and again is innervated by these cranial nerves. Probably the hyoid, the infrahyoid and suprahyoid, not going to focus a ton on that on any type of exam. This is more just kind of FYI. These muscles exist. Okay. Muscles of the neck that move the head. It's a pretty important motion. So if we look at these muscles here, you can see this semispinous capitis located here and here, just kind of at the base of the base of the head. You have your occipital bone here, so you can see it's going to be an important point. Spinous capitis, semispinous capitis, spinous capitis, splenus capitis, and your sternoid, cleoid, mastoid, also located here. Longimus capitis, which we talked about in terms of nomenclature not too long ago, in terms of the length of that muscle. Again, we'll continue our conversation. We'll be hitting some of these other muscle groups when we talk about other functions, but for the purpose of this particular figure, just all of these highlighted ones, the ones in bold we'll be talking about. Sternocleidomastoid mastoid. Okay, so this is interesting in terms of the action. So the acts together deflects the cervical portion of the vertebral column, extend the head at the atlanto-occipital joint, acting singly, aka unilaterally. And so it's able to laterally rotate the inflex head to opposite sides of contracting muscle. What's interesting about this is that again, you've got different cranial nerves that are innervating the sternocleidomastoid mastoid, or that innervating that particular muscle group. The semispinous capitis is going to be acting together to extend the head and vertebral column, rotating the head to side, opposite of the contracting muscle. The splenus capitis is going to extend the head and act together, extend the vertebral column for the respective regions. And here you can see the innervation is just going to be the cervical spinal nerves. Longimus capitis is going to extend head and vertebral column, lateral flex and rotate head to the same size as contracting muscle. It depends on what other muscles are acting. And spinous capitis extends head and vertebral column. And again, these are both going to be innervated with the cervical spinal nerves. Okay. Kind of this last section, we'll talk about muscles of the neck and back that move the vertebral column. So some of these we've talked about briefly before. We were talking about head movement. So that spinous capitis, the semispinous capitis, the longimus capitis, the spinous cervicus, the splenus cervicus, the iliocostus cervicus, the longimus cervicus. Again, we're going through quite a bit here. The longimus thoracis, the semispinous thoracis, the spinalus thoracis. You'll notice that there's kind of a general trend here between the nomenclature of both the first and the second word. So the second one more related to the region of of maybe that correlates to the region of the spine that we're talking about. And then you have your icostalus labiorum, and then your rotator, as well as your multifidus. So you can see again how they correlate to different regions of the spine. Okay, so if we look at the muscles that move the neck and the back, we can see here that there are some kind of much smaller muscles than we're kind of used to looking at here that are integrated into between those vertebral column bones. So the interspinalis, you can see there between those two vertebral columns. Here's your rotator, again, that kind of is transverse in its innervation, or not innervation, but in its origin and insertion. And then your intertransverse seria, again, between the different regions of the spinal column. So here you can see the anterior scalenus and the middle scalenus, as well as the posterior. And I feel like, and so these are going to be the muscles that are going to be interacting with the spinal column in between individual different individual components of the spinal column itself. Okay. So, okay, just want to see kind of how far back we are. So we've kind of hit upon, again, a bunch of these different muscles that are important for this movement of the back and vertebral column. So the splenius capitis, again, acting bilaterally, it's going to extend the head, it's laterally flex and rotate the head to the same side as a contracting muscle, and then the middle cervical spinal nerves will be innervating there. So you'll see kind of a general trend here when we're talking about these muscles that are interacting with the spinal column, but it's generally the region that, that those muscles are acting on that you see the innervation coming from. So the splenius cervicis is inferior cervical spinal nerves, and then it's going to extend this head and lateral flex and rotate head to the same side as a contracting muscle. Iliocoscus cervicis is going to be, in its origin, the ribs, and insertion is going to be the transverse processes of C4 through C6, and not surprising, the innervation comes from some of the same region, and so it's going to extend and maintain erect posture of the vertebral column on the respective regions. And then in the intercostus thoracis is going to also laterally flex the vertebral column and at the same side of there as the contracting. And this is going to be the thoracic spinal nerves that will innervate this particular muscle region. Okay, so so the iliopsoas laborum, those are going to be the lumbar spinal nerves that are innervating that particular region. The longissimus group, longissimus capitis, longissimus cervicus, and the longissimus thoracis also are going to essentially work to extend the vertebral column and interact with the lateral flex of the columns to their respective regions. His innervation is going to be cervical and superior thoracic nerves, as well as some lumbar nerves, depending on how far down the projection goes. Okay, so the spinalis group of the medial, spinous capitis, spinous cervicus, spinous thoracis, it's going to, the innervation is going to correlate that. And these are going to essentially act together to extend the vertebral column for the respective regions and extend the head. So I feel like we kind of keep saying the same thing here. It's going to extend the particular region, and if it's working with muscles of the same region, it's able to flex from side to side laterally. Okay. Okay, so these last few slides, I feel like this lecture has gone pretty long. I feel like we've kind of been saying the same thing, especially when we've been talking about these muscles of the head and the back. So I'm actually going to cut it here and go ahead, and we're going to start with this same material for Thursday. There's going to be some overlap with it, just because I don't know about you, but I'm actually feeling a little bit of fatigue just because of the, I guess not the depth, but just like the rhythm of this particular material. So yeah, I think I'm just going to pause, post this portion of the video that we've gone over thus far, and then kind of go ahead and finish up some of these muscles of the neck and back when we record the lecture for Thursday, because I feel like we kind of we have a couple different regions yet to still cover. So yeah, if you have any questions or concerns, please feel free to let me know. And I hope you all have a wonderful day.